care and how huge an impact it has on the NHS, its ability to find beds and fund itself. Well, let's talk about two of the people who are very much involved in that. Former Health Minister and Liberal Democrat MP for North Norfolk and his party's health spokesman Norman Lamb, and also Stephen Dorrell, NHS Confederation Chair and, of course, former Health Secretary as well. Good morning to you, gentlemen.
Good morning.
Good morning. Now, you are among the many voices that are joining in this call for the new Health and Social Care Secretary, Matt Hancock, to grasp this social care challenge. Of course, it was his predecessor, Jeremy Hunt, the longest-serving Health Secretary we've had for many years, who actually asked to have that social care title added into his job title. But the reality is that healthcare funding comes centrally, and the Health Secretary has a say over it. Social care funding comes via the government to local authorities and is dealt with by them. What can Matt Hancock do about the social care issue if it's not directly within his remit? Can I put that to you, Norman?
Well, it needs to be sorted. Of course, the change of adding social care to Jeremy Hunt's title was purely cosmetic, ultimately. The department's always been responsible for social care. I was the minister responsible for social care policy, but of course there's a separate government department, the Department for Communities and Local Government, which is responsible for councils, where, as you say, social care money goes. And it's completely disjointed. We won't get a proper and effective health and care system until we bring the funding of the two together and until we integrate care, join up care to support people, particularly because these days the big challenge is people living with a whole range of chronic conditions. And individuals don't see a difference between NHS care and social care. They just want to be effectively looked after. So we have to have a mechanism to bring these two together. So far, the government hasn't confronted it, and they haven't confronted the big funding challenge of social care. So Stephen Dorrell's letter, along with Neil Dixon from the NHS Confederation, absolutely right in the need to confront this challenge.
Well, this it. I mean, Stephen Dorrell, you're a former Conservative Health Secretary. This letter says we do not need an NHS plan. We need a health and care plan. The current system is fragmented, but can be united behind a set of common priorities. Can you just explain to us, Stephen, how much social care it has impact on the ability of the NHS to provide a health service to us?
Well, I agree exactly with what Norman Lamb just said, and I think the best way of illustrating the answer to your question is that we all know that we're getting older, we're living longer. That's all good news. But as we get older, we need access to hospitals and doctors when we're ill. But increasingly, what we actually need is support in the community to avoid having to go to hospital and go to see the doctor. And that's the service that provides support to older people, as well as to people living longer with disabilities, isn't just an issue about older people, but the people living in the community needing support. And if that support isn't there, what happens is they end up in the A&E department or the GP surgery. So trying to plan a future for the NHS without planning a future for care, what we need as human beings is, yes, medicine when it's necessary, but care and support in order to avoid seeing doctors and nurses if we don't need to be ill.
But Norman Lamb, we are talking about huge sums of money here, aren't we? The social care budget has been massively stretched as people are getting older and older. And there's been this big debate, and it was even a debate, wasn't it, during the general election with the Tory party manifesto over what constitutes, part of the health service, and whether if you're ill with dementia, not getting your care paid for free, but if you're ill with cancer, it is paid for free. Is this something that we need to have maybe a national debate on? Do we need to have some sort of national commission, all-party commission, to agree some terms and take this forward in a non-party political way? Is that the answer?
Well, Julia, you're saying exactly what I've been saying for the last 2.5 years. I've worked alongside Stephen Dorrell making this case. Sorting this out is not straightforward. It's quite politically difficult. Asking the people in this country to pay more tax is not easy for any political party to do. Also sort of confronting some of the freebies. I've recently turned 60. That means I'm now entitled to free prescriptions. That's pretty ridiculous, given that I'm on a good salary, and there are very many people who aren't entitled to free prescriptions, who have to pay, who are on a much lower income than I am. So we need to sort all these things out. And the only way, actually, you can get a long-term settlement, both for the NHS and the care system, and find ways of bringing the two together, is by working across the party. It's a long time since 1948 when the NHS was established and the divide sort of formalised at that point between the NHS and social care. We need to revisit it now, and we need a long, sustainable settlement. And we can only do that by getting politicians from across the political spectrum to engage in it and to sign up to it, and critically engaging with the public and the staff who work in these services. Well,
Stephen Dorrell, coming back to you as a former Conservative Health Secretary, I mean, do you despair at the lack of funding of the NHS, or do you say, look, actually it's great, the NHS is one of the few areas of public spending that wasn't actually hit so badly by austerity? It's been going up. The trouble is, it needs to keep going up at almost an exponential rate to keep up with the demand, doesn't it?
Well, no, you see, I just think that's plain wrong. What the government, I think, in fairness to the government, it's entitled to credit for the fact that what it announced to coincide with the 70th anniversary of the NHS is a medium-term funding plan for the NHS, for the treatment of illness. But the whole purpose of what we've been discussing this morning is that actually what the public policy, both central government and local government, should be focused on is, yes, treating illness when it arises, but avoiding it when necessary and providing care and support in order that people can lead lives that are as normal as possible. What's required is the medium-term plan for the NHS, which we've got, but a medium-term plan for the services which ensure that we don't need to, that we reduce the demand, if you want to put it that way, on the NHS by providing people with support so that they don't need it, or we avoid avoidable illness. That's what we're very bad at in this country. We wait for people to get ill before we provide them with support. What we should be doing is enabling them to avoid the illness, and that's the best way of addressing your point about, is this a bottomless pit? No, it does not need to be a bottomless pit if we have proper community support around it.
Well, let's hope that the new Health and Social Care Secretary, Matt Hancock, is listening to your message. Stephen Dorrell, NHS Confederation Chair, former Tory Health Secretary, and Norman Lamb, Lib Dem spokesman on health and former Health Minister himself as well. Thank you very much indeed.